Today, on World's Diabetes Day, let's address a very important question that most of the patients have in their mind. So the question is whether a diabetic patient can safely undergo a knee replacement surgery. So firstly, let's understand why sugar control is more important before surgery. So if your sugar levels are high, then there is high chances of infection. Secondly, if your sugar levels are high, then your wound healing will take longer time than usual. So what should we do? We normally do two tests. One is HbA1c and second one is fasting blood sugar. If your HbA1c is less than 8 and your fasting blood sugar is within a range of 140 to 180, generally it is considered safe to perform a knee replacement surgery. But if your sugar levels are high, then no need to worry, because in that case we will take the help of a endocrinologist who will help you to decrease your sugar levels. And once your sugar levels are within the desired range, then we can safely perform your knee replacement surgery. So the whole point is a diabetic person can safely undergo a knee replacement surgery if his sugar levels, that is fasting, is less than 180 and his HbA1c is less than 8. But if sugar levels are high, then we can wait for some time, take the help of endocrinologist. Once the levels are within the desired range, then we can safely perform the surgery. Thank you.